The goal of the training exercise out here, it's a 2-week training exercise. Dental Battalion's putting it on so that general dentists and dental technicians, Navy corpsmen, can learn how to set up the dental units, ADALs, Authorized Dental Allowance List, in an austere field environment. We want the dentists and the corpsmen to be able to set up, learn the equipment, and work out in the field independently. Dental combat readiness is important because we want warfighters to be able to operate at their peak ability and capacity, and anything dental-wise that's going on with them, dental pain problems, anything that's taking them out of the fight is preventing them from accomplishing the mission. So the goal, one of the goals out here is to see Marines that maybe came back from one of the recent exercises, MWX, ITX, were delinquent on their exams, trying to get them in, get readiness checked out for them so that when they deploy next, nothing will be going on with them. The Marines that are going out on deployment, we just want to make sure that if potentially there's not a dentist out there with them on deployment, that they don't have any foreseeable issues. We wouldn't want them to have a problem out in the field and then have to be medevac somewhere or take them out of the fight so that they couldn't accomplish the mission. So the dental equipment that we bring out with us is a set of pre-designated boxes that include equipment that we can perform any dental procedure. We bring dental chairs, they're portable and lightweight, and we also have the dental handpiece units, which are used for drilling, doing fillings, things like that, that are combined in kind of a suitcase-like apparatus that can be opened up and taken out and put back together really quickly. So if we're on the move, it can be transported in a matter of minutes and set back up again in another location. Other than that, we have the traditional items that are used for fillings, root canals, x-rays. Our x-ray unit is portable also, can be used without being connected to a wall or plugged in. So it's a handheld device that makes travel very easy. This exercise has been unique in that we've been able to have a lot of Marines from different units come out and provide training for us. This hasn't happened in the past, but we were able to get some weapons out, some radios out, and get the corpsmen and dental officers familiar with some of the equipment that Marines use that maybe we haven't had the opportunity to familiarize ourselves with. I think it's been a really fun experience for them to kind of get out of their comfort zone and out of their MOS just a little bit, make them more prepared for deployments in the future, exercises, if they might be called upon to do additional tasks outside of dental.
So the main goal of this exercise is basically just to train dentists and dental corpsmen how to troubleshoot and work out in the field. In a clinic, we have a lot of access to a lot of, I guess, more convenient either instruments or materials. So when we're out in the field and having to do it, we kind of have to figure out how to get the job done without all those things. So I think this exercise is important just because the hands-on practice for the dentists and for the dental technicians or dental corpsmen. And then dental readiness is just important because when you need it to deploy, you can't deploy as a class 3 or 4, and then your mouth is really important. So any infections or any problems you have in there are going to cause you a lot of pain later, and the last thing you want is something like that to happen out when you're deployed. So what's really cool about the equipment we bring out here is very similar to what's in the clinic. It's just portable. So everything we use to sterilize, we have versions here that go on tabletops. Everything we use to either suction or provide water, we have portable machines for that. So the procedures we're conducting out here are your annual exams when you go to dental every year, and they just do an exam to see what's going on in your mouth. And then we also have operative, which is if you have a filling that needs to be done again, we can do that out here too. I think what's impacted me the most out here doing this exercise was building the tents. I think normally you're used to having Marines there to help you build everything, so it was just corpsmen and dentists, and we're building it together and working as a team, so it was pretty cool.
I've learned how to take apart a couple of machine guns, how to load them, how to troubleshoot them. I've learned to put together some radios and how to make like a 9-line over the comms. I've learned how to set up a dental unit in the field. Whenever the patient comes in, I'm just there to hand the doc the instruments that he needs. I'm there to set up, break down, and schedule patients for the docs. So whatever dental thing they need, I can schedule them. I definitely prefer being in the field more than I prefer being in a clinic. Just the field setting, it's a little bit more relaxed, and everybody's a little bit more helpful. I'm just a little HN, basically do what I'm told type thing. But I mean, they don't tell me anything that they wouldn't do themselves or they haven't done themselves. So they're just giving me the experiences that they have.
During this training exercise, my role out here is as squad leader. I was invited back during this ADAL because I participated in the last one. The difference in this training exercise and the one last time, I believe, is just a lot more Marines have been coming out helping us with land nav, weapons fundamentals, battle skills. So we've just been getting the maximum amount of training during our time out here. So my squad's comprised of 4 dental techs enlisted and 2 dental officers. So the biggest challenge, I think, is just the accountability and them leaning on me kind of for the matter expert since I've done this before. So just stepping up and being a leader for them is awesome. As a dental tech, I work at Osborne Dental Clinic. They can pull us to x-rays, to CSR, which is our central sterilizing room, anything from dental teching, assisting the doc, to keeping records. We have a very wide range of responsibilities as dental techs. And the most important, especially being greenside, is just being ready at any moment to deploy with the Marines. Being out in the field versus in the clinic, the roles are pretty much the same out here. Obviously, a lot more stuff is limited, so we're working with what we got, but it's just building our skills. I've learned so much during this training exercise. I think it's, awesome to keep growing as a sailor. There's little things about weapons, about land nav that the Marines taught us, and then even about teching that I have learned during this exercise for sure. The importance of dental combat readiness is becoming subject matter experts out here so we don't mess up out there. So although it may seem tedious or, why is dental in the field, we get that question. People are genuinely curious. It's so we're ready that we can bring what we need to bring to the plate when we serve along the Marines.